Are you looking for ways to help your patients manage pain more effectively and possibly reduce the need for opioid prescriptions? Then today's podcast is for you. Welcome to the Journal of Pediatric Surgical Nursing Podcast. I'm your host, Dr. Terry Clark. I'm honored to welcome our guests today, Michaela Williams and Kylie Dinker. Michaela and Kylie both have extensive experience in remote patient monitoring. Michaela Williams is an advanced practice registered nurse with the Division of Pain Management at Cincinnati Children's Hospital. And Kylie Dinker is the clinical director for the Home Care Agency and Remote Patient Monitoring, also at Cincinnati Children's Hospital. Welcome, Michaela and Kylie.
Hi, thanks for having us.
Yeah. Thank you so much for joining us. So you recently co-authored an article in the Journal of Pediatric Surgical Nursing titled Remote Patient Monitoring for Post-Operative Pediatric Patients with Peripheral Nerve Catheters. So Kylie, can you tell us more about the Remote Patient Monitoring or RPM program?
Yeah, absolutely. So we started remote patient monitoring or RPM at Cincinnati Children's back in 2017 as a feasibility pilot. And then we realized what great outcomes we could have for our patients and moved to a centralized nursing model in 2018, which is when I was brought onto the team. So our goal of RPM throughout all of our programs is that we provide an increase in touch points and communication for our families and our caregivers or our patients, because we do serve some patients who are able to manage it on their own. And that we hope we decrease the need for in-person utilization. So rather than just always sending patients to the ED or sending them in to be readmitted, hopefully we're catching some of their problems or pain points a little bit sooner, and we can address that while they remain in their home where they're comfortable and where they can heal most appropriately. So back in 2021, after we had sort of launched some of our inpatient focused driven programs, we met with the pain team and realized that there was a big opportunity within the ortho space to do an RPM program for post-op follow-up. And so that focused really on the need for having this high-touch education with our patients. And so could we use our RPM nurses to really provide that in-depth pain management and all of the education that comes with post-op, such as what does your nerve catheter site look like and how can we get you up and moving sooner, everything that they would really need to be able to most appropriately heal after their surgery. So we were able to roll that into an RPM program, as well as assess the nerve catheters in real time, which allowed for any sort of issues that may pop up to be addressed as soon as they occur versus waiting and calling and getting a call back or just bringing their kiddo to the ED. And then monitoring for those real-time signs of medication toxicity. So making sure that they're not having any blurred vision or anything that may prompt us to say, hey, we need to stop that medication right away because your body needs a break from it. So we started that back in 2021 and it went really, really well. And so then we decided that we were going to roll it out to this population as well in 2023. And we've just seen fantastic results with both of those programs since.
Wow, that sounds awesome. I'm the kind of person, I'm the patient that has my shoes on at 7:00 when the doctors make rounds because I'm like, I want to get home. So this program would be good for me.
Oh yes, exactly. Yeah, we're that in between. We're the hey, we can get you out of here at 7 a.m. because you're going home with us. So
yes. No, I've got my bags packed, my shoes on. No, I'm terrible. Anyway, okay. Thank you so much. So, Michaela, what are some of the key benefits of the remote patient monitoring program?
Yeah, so before I talk about those real quick, I think it's important for people to understand kind of where we started when we were sending these patients home with the catheters and what our process was prior to onboarding RPM. So prior to them coming on board with us, any patient that went home would get a phone call from our evening nurse practitioner or RN, usually, late afternoon, early evening, but they would get a call for anywhere from 4 to 6 days after the surgery, depending on the type of surgery. And we would call and touch base with them to talk about the same things that Kylie just kind of touched on: toxicity of the medications, the pain, how the catheter site looked. And like I said, that was a phone call. And it was one person who also was covering for 2 inpatient services, pain services within the hospital as well. So that proved to be very time consuming for the provider, as well as it was kind of inconvenient for the patients, especially timing. Some parents were at work, some parents they were eating dinner. We realized that there was a need for something to change from both a provider and a patient follow-up perspective. So that's when RPM came in and kind of saved the day. So as far as benefits go, from a patient perspective, RPM has allowed us to meet parents and patients where they are. It is a daily app that they have on their cell phone or their device that allows them to answer the questions that we would have called them for at their convenience throughout the day. If by 6 p.m. the remote patient monitoring team hasn't heard from them, then they do get a phone call. But it just opens them up for a lot more flexibility in their day. It actually increased or improved follow-up by 93.3% for our ortho patients and 92.4% for our pectus patients, as far as throughout the entire program that these patients graduated from the program. It was allowed for faster follow-up time. So the nurses that are with the RPM team, they had response times of under 6 minutes for ortho patients and under 4 minutes for pectus patients, which is incredible. These patients who had issues or who had flagged responses were getting feedback and were getting care right away, which is huge. And then also having scheduled video visits. So these patients get seen by one of our RPM nurses at least once throughout their program, which that has enhanced the patient experience and also increased the comfort of patients and parents caring for these patients at home. Having a nerve catheter in their child, no matter where it is, can be a little bit daunting. So having someone to kind of go through that with them, to visualize things and to have that direct contact with them has really improved patient experience scores. And most at the end of their time would recommend the program. From a provider standpoint, we've seen fewer calls, which has improved workflow. We're not calling 10 plus patients in an evening anymore, but it's also increased or allowed for those providers to have more time allotted to the patients who need responses and who are having side effects or who are in need of care right now. And then also there has been a huge reduction with the remote patient monitoring team. We've been able to monitor how much opioid they've actually been able to use. That was something that we've tracked with the remote patient monitoring team. We've actually had a huge reduction in the opioid pool. The decrease in post-op ortho patients, it went down by 50% in the amount prescribed, and identification of 64.9 patients using less than 50% of their prescribed meds after a pectus surgery. So we've been able to completely knock down a lot of the opioids that were previously being prescribed because we've been able to monitor how these patients are doing.
Yeah, that's amazing. Well, it's such a great program. So with all the benefits, what limitations have you seen?
So there are a few limitations, and actually when we published our article, things have changed a little bit, but it used to be that English was the only language that was available in the app that we use. So anything other than that required a daily phone call by the remote patient monitoring team or the pain RN or APRN. But we also then needed to call the interpreter services, which can just be a lengthy process for both the family and the provider. But recently, Spanish is now available in the app. So we're seeing some of that changing a little bit, but right now English and Spanish are our two languages that we're able to utilize within the app.
That's great.
So, that could be a drawback depending on the culture of the patient. And then also lack of internet or device access. It's not as common these days, but there have been some that they live very far out and they've had to travel to make a phone call, let alone like get on a device throughout the day. Or they just don't have a smartphone. We've had a lot of patients where that's been the case. So these patients are still enrolled in the program and they're usually followed by a phone call, but it just makes it a little bit more difficult for the convenience aspect of the program.
Right. Now, are you finding that insurance is supportive of this?
Insurance is great. So there are currently 4 billable codes for remote patient monitoring. These patients do not meet 2 of them because they're not enrolled for more than 16 days, but there's actually legislature out right now that is hopefully changing that starting in 2026. But it has been actually relatively easy, I feel like, in the landscape of insurance,
Okay.
because it's such a supported and needed program. When you think of what RPM use cases are outside of pediatrics, there's a lot for adults with COPD or heart disease, and it's shown such great outcomes that there's a lot of support from payers to be able to use these things because it's preventing this in-person utilization, and their dollars spent are a lot lower.
So where do you see this remote patient monitoring headed in the years to come?
Yeah, I think there's endless opportunity. If we think about the pain space, I would say there's opportunity within chronic pain management, that things like pancreatitis or other long-term chronic diseases could really benefit from using RPM to monitor their patient's progression and their pain and how they're just doing overall from a well-being perspective, to give that support to those families that may feel like they don't really have anyone left. And then outside of that, from an acute standpoint, if there's any other surgeries that would eventually require the use of a nerve catheter, I think we've shown that our outcomes there have been really great. And so it would just make sense for us to roll that into any future surgeries with that. And I think, just to echo what Michaela said too, the fact that it's convenient because we're using an application that families get in whenever it works for them throughout that day, and they can answer the questions, they can message with our nurses on demand, we can do video calls on demand. All of those tools really bring the care to the patient and meets them where they are. So when we think about the expansion of what RPM looks like in the future, I think every patient could benefit from it, because I know that me as a mother, I would benefit from this, of having just a nurse on my side to say, I have no idea what's going on right now, or I just need a little extra hand, a little extra love. Can someone please help me out? And it's, again, just that convenience piece of it. It really just helps with any barrier that the family may be experiencing, whether it's transportation or childcare, social issues, things like that. We can really step in and be a helpful resource for them.
Amazing. Well, thank you so much, Michaela and Kylie. Thank you for joining us and sharing your expertise on this innovative idea. It's very exciting. Thanks for joining us.
Yeah, thanks so much for having us.
Thank you.
And to our listeners, thank you for listening. You've been listening to our guests, Michaela Williams and Kylie Dinker. Thank you for tuning in to episode 2 of the Journal of Pediatric Surgical Nursing podcast. Be sure to subscribe to our YouTube channel, share this episode with friends and colleagues, and share on social media. You can find links to today's article and the journal in the show notes below. We appreciate your support as we continue to promote excellence in nursing. Until next time, I'm Dr. Terry Clark, wishing you peace and health.